Okay, well, welcome to today's Grassroots Health interview. Today we are speaking with Dr. Scott Jensen, who has been practicing the Coimbra Protocol here in the United States. Welcome, thank you for joining us today. Can you just give us a brief introduction of yourself and your medical background?
Sure. My background is in family medicine first. I did my residency in Arizona, in family medicine, and then I went in '99 to '02, and then I went into the military and did some time in the Air Force, serving for about 4.5 years, and then had my own practice since 2007, which has probably just since COVID 2020 become more of a telemedicine based practice. And I became board certified in integrative medicine around 10 years ago as well. So I maintain both board certifications, use both sets of knowledge in my practice. So that's a little bit about me, but I started doing the Coimbra protocol around 2017, 2018. I was trained with Dr. Coimbra. Um, and so I've been using it since that time and done some functional medicine training in that time frame as well. And also a fellowship at the U of A in integrative medicine. So I've been involved with that for the last 10 years. And so that's where most of my training comes from.
Okay, thanks. And in your integrative medicine training prior to the Coimbra Protocol, I'm curious how much emphasis or how much did you learn about vitamin D or even therapeutic or high doses of vitamin D to treat certain diseases?
Really, not much. We were with the fellowship at the U of A, they would talk about following the Institute of Medicine guidelines, which are pretty conservative. They're, no more than 4,000 IUs per adult, maybe 5,000 if you're really on the edge, for a daily dose for adults. And then, of course, stepwise down for pediatrics, you're quite low. So that was as edgy as we got with vitamin D prior to doing the Coimbra protocol. So that was pretty new for me to do that.
Mhm. So nowhere near therapeutic uses and just barely not even touching on what we would call optimal recommendations for vitamin D, it sounds like. What
Correct.
what
Yeah.
what grabbed your interest in going down to Brazil and training with Dr. Coimbra?
Yeah, it was. I had a patient that had multiple sclerosis, that was a young mom of 35 or so years old, and she had found the Coimbra protocol. I had never heard of it before, and she was basically wanted me to help her with it. And she said there's some labs that I would need to order to help her. Would I be willing to support her? And she said that she was going to follow with a provider who would sort of advise, but I needed help with the lab. So I said I was sure I was able to help her with that. And I'd followed her kids before, in the practice. And so I just investigated a little bit, and I found an old study from 2013. I think it was 2003 or so. It was an old study from Dr. Coimbra in treating vitiligo and I'm trying to think of what other disease, but skin diseases, basically using the Coimbra
Psoriasis,
protocol.
maybe. Yeah.
And I think it's still the only study to date that used the formal protocol. And I saw these skin diseases, like the before and after pictures, and I was intrigued, I mean, by it at that point. And then just the good experience that I had with this patient, who really improved. I mean, basically went into remission. And then I saw that there was a basis for it in the skin diseases. Then I was interested in traveling and getting formal training in it.
And just if you wouldn't mind, just give us a really quick idea of what that training was like. You went down to Brazil. I've heard there's, you get to spend a good amount of time with Dr. Coimbra, but what was
Yeah, it was different schedule than the usual American medicine. So I'd show up probably about 8:30, 9 o'clock, and then we would maybe get started around 9 or 9:30 or so. And we would maybe in 12 hours time, we'd have probably an hour break in between, and we would probably see about 3 to 4 patients in the entire day. So it was about 3 hours, sometimes even 4 hours a patient that we were spending with someone. And it was mostly in Portuguese. And then there's occasionally he would break and talk to me in English, and then he would break right back into Portuguese with the patient. So it was really a lot of patient contact with each person, more than I've ever seen. And there were patients had to be willing to wait for an hour, hour and a half in the waiting room because he would go over time. But people were traveling from all over Brazil and sometimes other parts of the world to see him. So it was it was a different, much different environment than the quick pace of American medicine.
Right, right.
Yeah.
So, since practicing the Coimbra Protocol, have you run into any issues here in the United States? Any pushback from using high doses of vitamin D? Any unforeseen difficulties that you'd like to share?
I haven't had many problems really with it. There's been a few times where there was like another provider that might have had another patient that I knew of that had some problems that went into like renal failure or something like that. But there's been a few cases I had some hypercalcemia, but I was able to treat it outpatient. There was just one case really that kind of surprised me. That was a young lady that was we were only putting her on 10,000 units of vitamin D, not even going to get labs on her. And what she ended up having was a granulomatous disease. So she had a high urinary calcium to begin with. So she couldn't tolerate even small doses of vitamin D. So since that patient, I'll always check a 24-hour urine before. And then Dr. Coimbra gave me some additional training in handling patients that could have granulomatous disease. And you just use very, very low doses, very gradually, to eventually help with the granulomatous tissue, kind of using up all the calcium, and eventually you're able to, over a period of time, months to years, you can eventually get a regular dose of vitamin D started where you could work up to those higher doses. But that's a rare patient that has problems. I've never really had anyone else have a problem. I did have a lady that was taking the Coimbra Protocol, and she was adding some other liver toxic herbs, and she had a problem and she had to be in the hospital. And I had a discussion with that provider, with the primary care provider, and it was really not the Coimbra Protocol, but it was the herbs that she was using that weren't really a part of it that she brought in that were a problem.
Right. Right. Yeah. Now, that renal patient that you mentioned, was that a patient that had been yours that had some renal difficulties because of the high dose vitamin D? Or have you ever seen any patient who may have gone into toxicity and didn't recover fully?
Yeah, so if it wasn't a patient of mine that was in the hospital, but what happened was for myself, seeing if I ever see renal changes happen, which sometimes they will, slight changes, I just back off. And I've never seen a case, if you catch it, where if you just back off the dose and give them time to recover and maybe figure out a good dose that works for their kidney. The kidney is a great thing to watch with the Coimbra protocol. If you can make sure that you're watching that, that's really keeps people out of trouble, and it just tells you what their body is capable of handling. And I think it could be different for every person. But I found that if I just watch that, I've never had anybody not just go back to normal or their normal baseline where they were before, if I just
Right.
am mindful of that.
Right, right. Yeah. So, I mean, I know because I've been helping to kind of build a Coimbra protocol outline that we can hopefully soon share here in the United States. But Dr. Coimbra is very big on making sure you're getting enough fluids, drinking a lot of water, avoiding very specific medications and foods that could be taxing on the kidneys. But My point is it's much more than just taking high doses of vitamin D, and this is why it's so important to work with a trained Coimbra Protocol practitioner, somebody who's very knowledgeable in using higher doses of vitamin D. But what are some of those other just like key components of the Coimbra Protocol besides the high dose vitamin D? And let me rephrase high dose because that to some people 10,000 IU a day is high
Hmm.
dose. So maybe what is how is that dose of vitamin D defined? Just very briefly, and then
Sure.
what are some of the other components that are important to the protocol?
Yeah, I asked the same question to Dr. Coimbra, and this is what I remember him telling me was that once somebody gets over 10 to 20,000 units of vitamin D daily, you would consider that to be a mega dose of vitamin D because then it's getting beyond just their weight and you're going after something therapeutic that's not typical. In those cases, you would have to follow the low calcium diet, and be much more mindful of the low calcium diet. If someone is on doses that are above 40 to 50,000, they really have to be very strict with the low calcium diet. Most people have to be pretty strict. And you find out how strict they have to be just by monitoring their 1 month urine test once they start at a particular point at following a treatment plan. You just follow it 1 month later, check the 1 month urine again. And if they're able to keep that urine, that amount below 300 milligrams of calcium in 24 hours, then they're probably okay, unless you want to try to move higher. And if you do, then they have to be even more strict still if it's necessary to try to go higher. So it just depends on each case, what's appropriate with
Right,
with each person.
right. Yeah, and I vaguely remember we did discuss, Dr. Coimbra had a great set of PowerPoint slides that he reviewed in an interview that I did with him a few months ago. So I can share a link to that interview with this video. But he does have a very specific protocol or way that he determines the dose and then adjusts the dose. So but again, it takes measuring the PTH levels
Mhm.
and staying on top of those urinary calcium levels. And then, so you mentioned diet. Besides diet, are there any other really key pieces that you have found to be absolutely essential to the high dose vitamin D Coimbra protocol?
Yeah, I mean, the fluid intake is important. So I would say, they need to maintain at least 2 liters of water daily or fluids daily. And then I mean, the supplements that can be helpful that could be supportive of vitamin D working are also important. So I definitely I emphasize the magnesium and also riboflavin, and then the other supplements that would be included in the protocol. So that would be fish oil, and there's lesser amounts of other vitamins that have been characterized or that have been specified by Dr. Coimbra, and you can see that the Pinkleton multivitamin is pretty up to date at including those. And you've spoken to Dr. Pinkleton about that, and so I refer people just to her vitamin as a way to simplify it so they don't have to bring in so many supplements and it can get kind of overwhelming.
Right.
So
Yeah.
probiotics are kind of a plus or minus, and then we can talk about vitamin K2. That's another one that for the Americans in the protocol, I think may be more important than other places in the world where vitamin K2 is maybe better supply
Right.
in the diet. So
Yeah. Yeah, we did talk about that. That
yeah.
you know, Dr. Coimbra, he kind of did his own little trial with the K2 and didn't really see much of a difference. But I believe they are probably more likely to get vitamin K2 in their diet down there
Mm.
than we are here. What other differences in the protocol or dietary advice or anything that you learned down there? Is there anything that really stands out to you that you've had to modify a little bit more for here in the United States or anything that you've added?
At times I think in the US protocol, we've added a couple of probiotics at times. Um, that, I mean, in the past, I haven't really like pushed those as much in at this time as we did in the initial first few years of doing it in the US. But I think I have to look back and see if Dr. Coimbra has added probiotics. I don't know that he has, but we will sometimes add those in the US as another way to prevent infections, um, and kidney infections especially. But there isn't really anything I can think of. One thing that surprised me though is I had a patient that worked with a trainer. She was an MS patient, and she was working with the trainer. And during the time she was working with this trainer, just with exercise alone, she got her PTH level down to therapeutic level with just a dose that was as low as 20,000, or it was between 10 to 20,000 units a day. So a very like pretty normal dose for someone with MS,
Hmm.
who can handle that dose of vitamin D, and she was able to get her parathyroid down into single digits.
Yeah.
So that was remarkable. I wasn't expecting that. But that's something that that a lot of people could work on that in America, work with the trainer, or could push themselves in it and get a good workout and and sometimes get a good PTH lowering that way too.
So I did have the pleasure of interviewing one of your patients.
Yeah,
We haven't
yeah.
released her video yet, but I'm really looking forward to it. And her story was quite amazing. It sounds like she made some of her own slight progress before finding
Mhm.
you, by
Yeah.
adjusting her diet, by really working on fixing her gut. And then she said when she got on the Coimbra Protocol, I think she said it was after what, about 6 months up to a year, that she
Mhm.
really felt like a different person. Felt, younger than she had in years. And but she was. I know Dr. Coimbra talks about avoiding a lot of different meats, whereas she
Mhm.
was, found that her diet that worked for her was the carnivore diet. And so adding that, and I think some additional nutrition for just helping to manage stress. Can you address that? How often do you see patients that actually really do well on maybe more of a individualized or personalized diet along with the protocol?
I've been seeing it more lately as the carnivore diets kind of got more attention. So I've seen more people try that diet. And so sometimes they do see just like the patient you mentioned, they do see a benefit, and they continue that. Um, there's been other diets too, that I can't think of some of the names, but some of the popular autoimmune diets. So I'm not against people doing those as long as we're able to keep the calcium under wraps. Then there's a lot of different ways you could do it. So I've seen that Americans are very innovative when it comes to diets. I'm kind of I have an allowance for that if there's some modification they need to make.
Mhm.
Um, yeah.
Now, were you the one who also told me about a specific dietary protocol for like psychological nutrition?
Yes, yeah. So one of the things I do, in addition, and unfortunately I did this after I didn't get to talk to Dr. Coimbra and run this by him, because it would have been great to talk to him after I did the training. But I did training with Dr. William Walsh in Chicago at the Walsh Institute, and they basically since the 50s they've done some training, or they've developed a lot of protocols to try to determine how to help people with supplements that have certain findings in their blood chemistry and a urine test that really it can help their mental stress level, their ability to handle depression, anxiety, tendency to get that less. And so a lot of the patients I found out what really perked my ears is when I was in the course, Dr. Wall said, yes, and by the way, multiple sclerosis patients have a likelihood of 50% of them having a problem that they call pyrrole disease, which is where they have it's a genetic problem where there's a problem with the pyrrole chemistry in breaking down red blood cells, and then they'll have a problem with a deficiency of zinc and B6. And so you can, when you do what I would do differently in the protocol is I would really focus on looking at a patient's B6 and zinc through their copper level, really, and then when try to address that at the same time that I start the protocol, if I find that. So
Mhm.
it adds an extra option in some cases where the protocol may not be like the number one thing that makes a big difference to them. It may help a little bit. Sometimes that other side will really make a difference
Mhm.
in if you can address the mental health side.
Yeah, yeah. Fascinating. Yeah, and that was a big, big point that Dr. Coimbra made was sometimes if a patient can't learn how to address and manage their stress levels, then the protocol just won't work. And then on the flip
Yeah.
side, he's also seen patients who learned throughout time being on the protocol, learned how to manage their stress, and they could actually reduce their vitamin D level or their vitamin D intake amount. So yeah, that connection is huge between stress and managing our emotions and our physical health.
Yes. Yeah. He told me the same thing exactly. And I still remember that being a point in the training that he told me to.
Yeah, yeah. Um, so what would a patient want to know, or what should they expect if they decided that they wanted to try the Coimbra protocol? And, would you be able to see anybody, like how do you qualify or onboard your patients? And what are some of the things that some patients maybe have had a really hard time being consistent with, or how what should they expect?
Yeah. Yeah, that's a good question. So when we see them, we're typically, they'll either kind of go through our office and talk to our front office about what their kind of their case and their interest in doing the protocol. Or they'll come through our direct health app, which goes to me directly. And then the first step is we usually will send them just an introduction set of labs because most of the doctors don't do the labs that we would need to know. It doesn't matter if they've been doing the protocol. I'm okay with that. I just want to make sure that they're safe doing it. And then we get that set of labs, and then we get back to them. Ideally, it's usually with the call. It's a call at that point and reviewing the labs and then making a plan for that person. And then once we execute that plan, a month later, we check the urine test again. And then we check the labs about 2 months after that, so that we have urine in the blood test. And we just make sure that our plan at that 1 month mark, we're making sure that our plan is okay, that it's not overdoing their vitamin D, their calcium level. If it looks fine, then we go ahead and continue. We expect now by 1 month, what Dr. Coimbra taught me, and I think it's still probably in his paperwork, is about the 1 month mark. You hope to see an improvement in energy level first. So if you see that person noticing that they're getting a better energy level, they're feeling more like younger, like you said before, then that's a good sign that you've got a good start. And then you wouldn't change anything. You just keep going till you get to the 3 month, and then we check it again and see whether we need to adjust it at that point.
Right. And what types of changes have you seen? I don't want to use the word fail, but
Yeah.
that have been a lot more difficult for patients to adhere to and sustain,
Um,
if any.
if any.
The challenges, what kind of challenges, what
Yeah.
do they expect?
I think sometimes people have a hard time with the fluid intake of it being, so much. And some of the patients with MS that have had it for a long time, they start to have problems with their bladder too. So they'll just say, "Hey, I can't follow this. It's just if they're really limited mobility and they're having to go to the bathroom so much, that can be a real problem for some of the patients that have had MS for a long time. And I've had some of my patients that can't do it. Um, the other challenge is exercise. We want them they need to do some type of a vibration platform if they can't do some type of walking exercise or something that will keep their bone density healthy when they're getting so much vitamin D, because we don't want them to have a problem with uh, developing osteopenia by taking that much vitamin D. Then you need to make sure that you're compensating with increased activity. Um, so that's one thing that can be a challenge, for the protocol. Um, I- Most of the time, if we get people that are at least somewhat mobile and able to get up and walk, then I think as long as we're able to keep them with some type of walking and the fluid intake, then of course, then it becomes the low calcium diet. That can be hard to follow. So people love their calcium foods. So that's a sacrifice they have to be willing to make sometimes if they want to make progress with the protocol. And
Mhm.
sometimes we just try to get a happy medium where they sort of get some of their foods and we keep them on a maybe a moderate dose, not as aggressive. And sometimes they're happy with that. And sometimes they get enough improvement. And then their doctors are also happy because they don't see this super high level of vitamin D. So sometimes you have to sort of meet them in the middle with that.
Mhm. Yeah.
Yeah.
What are some of the vitamin D levels that you've seen come back?
We've seen some highs. I used to hesitate to even get it, but after a while, I find it's helpful to see how high do you have to get it to make a difference for the person. So, I
Mhm.
mean, I've seen levels in the 300s. I maybe I've seen a few in the fours, but most of the ones that I see are maybe in the mid 100s to 200s. Um, and sometimes you can get a therapeutic result with a level that is really, you wouldn't call that low, but that is at that level.
Mhm.
And as long as I see the 24-hour urinary calcium in that safe range, I really that vitamin D level doesn't bother me as long as a person has no symptoms that they're noticing a benefit. There are times where we don't see a benefit, unfortunately. And some of those people, I don't want to push that level of vitamin D if they're not noticing that it's making a difference for them after we try it for a year or two. Uh,
Right.
then we
And
would,
what,
yeah.
yeah, what types of patients have you noticed don't respond versus certain patients responding better? Are there any indications that a certain patient might do really well on the protocol versus not?
I find the people that respond the best in general are if we're getting someone that's within the first like days to months of their disease starting, the sooner we can start it, the better off. I found females in general seem to respond better. That's just what I've noticed. I've noticed MS seems to respond better than some of the autoimmune diseases with a really rapid. I mean, just because there's such a lot of times the symptoms are so strong, you can really see rapid clinical improvement in MS, I think more than most. And I don't know why that is, but I have seen some people that have had MS for, say, a 10 years or so still respond and get some improvement. Um, but I found that the harder cases are usually people that they've maybe had the disease for 20 years or more. They have very limited mobility, so they can't do the exercise. They have bladder problems, so they can't do the fluid. So sometimes that's really just kind of aggravating the patient, and they're frustrated that they can't do the protocol, and we have to be more conservative because they're maybe not able to do all those things that are entailed in following the protocol. So that's kind of what I've noticed. I've
Mhm.
noticed anything where there could be autoimmunity, sometimes even infection involved, like a chronic Lyme patient. I've seen some of those patients respond to the protocol as well. And the doses sometimes don't have to be as high as they do in MS.
Mhm.
So I've noticed that as well.
What about family history? Have you noticed any link between individuals who have a stronger family history of MS or other autoimmune diseases versus somebody who just may have gotten it, I don't
Uh,
know, along with some kind of environmental toxin or, um,
Yeah, I haven't noticed that as much, but I do when I look for that on the mental health side, if I see strong autoimmune disease history in the family, I think of pyrrole disease, and I would really focus on their zinc and their B6 at that point
Yeah.
as well.
It's so interesting that you found that.
Yeah, I found that in my practice. That's been really helpful.
Yeah. Well, do you have any particular patient stories that you'd like to share?
I had I mean, I think my first patient is always been my the one I've always looked to that really got me to go to Brazil. I mean, because that was really the life-changing one. To this day, she's in remission, and that so it's been, that one is the greatest teaching. As a mother of five children, that was homeschooling and was completely bedridden with her MS symptoms. And she had just done this research, figured this out, and the just the to see her respond to where she is to this day, in remission, able to do everything that she needs to do for her family. Um, I mean, that's an amazing thing to see that I'll never forget. Um, I don't, I think the patient you interviewed as well is one that I've seen. I mean, I saw how much she improved in her life. I think those are the two I think that I really remember, that stood out to me, um, to see how much they've improved and they still continue to improve. That's the thing that, a lot of people get something that can help them for a while, but then they revert back. But in these cases, we were able to treat really early, and they're still in remission to this day,
Mhm.
which is
Yeah,
that's really rewarding. There's not very many things that you could do in medicine that will do that.
right.
Yeah,
Yeah. So good to hear that.
yeah.
So what suggestions would you have for another doctor who might want to learn about the Coimbra Protocol and start practicing?
I think, I would just consider it like you would, um, other therapies that we use for MS, and the safety that I've seen with vitamin D. I mean, it's one of the safest things I've ever used. Like I say, I've had those few cases where I had to help a person with hypercalcemia as an outpatient, and as long as the safety study that was done in, I think it was 2023, it I mean, it's very good. So if it had any hesitation, about safety, it's very safe compared to other therapies that you can do. And then, I mean, the other thing is that you always, if you're just in touch with the patient and what are their goals, how aggressive do they want to be? If they just want to try a moderate dose, they just do a moderate dose. You don't have to, you know, have this super high dose that you can kind of dip your toe in, if that's all the patient wants, to see what kind of benefit they could get. And the other thing I would say is that if there are people that don't have options and they're really at risk of significant disability, this is something you can do that can really turn a person around more than anything I've ever seen. More than drugs I've seen that are used for MS. Besides using acute steroids, to get him out of disability, this is really something that can, really change someone's life and keep them in remission, that I've seen. I haven't seen anything like this. And I never thought I would do, the other thing I would tell family practice doctors is I never thought I would be a doctor who treated MS or helped MS patients, but it's very rewarding to have someone that's very significantly their life is at risk. They really don't have hardly any options, and you can present something that is really very safe compared to other options they have, and just can show a potential great benefit for the right patient.
Mhm.
So
Right, right. And just out of curiosity, what are some of the highest doses you've had to use of vitamin D?
probably for me, I'm not as I don't I definitely don't break Dr. Coimbra's records by any means, but I've used I think the highest I've used in that I can recall is probably about 120,000 a day.
Okay.
I know Dr. Coimbra has probably doubled that. From what I that the when I trained with him, there was a patient that he put on that dose, but um, I'm probably more conservative than Dr. Coimbra. I would say that. But I feel like I'm safe and I'm comfortable and the patient's comfortable and I don't have people getting hospitalized. So I
Mhm.
feel very safe at with what I'm doing, and I feel like it's accomplished good things for the people with taking lower risk, and that's kind of my goal. It's a great tool that just has to be used appropriately. So.
Yeah. Are there any particular brands that you recommend or avoid? Have you noticed any difference?
I we you know I there was one of the guys that was doing the protocol early on was Michael Colley. He was I would text him whenever I had supplement questions, and he would study the supplements, and he knew like if I ever have a supplement question, I'll go to him. But he and from early on in some of my patients, we liked vitamin D from Life Extension, the one without mint. For some reason, without mint, it had to be without mint. So there's other ones people can use that are just fine as long as I think they keep the same consistency. You can probably work with other brands as well. But we found that one especially really stable,
Mhm.
and we're getting good clinical results with it.
Yeah, yeah. And I would assume because I have heard and seen different responses to different brands, and then sometimes a different brand will have a different amount of vitamin D in it. So it's really important to use a high quality brand. Um, well, before we close, is there anything that I forgot to ask or that you want to add?
No, I think that's a great overview. I can't think of anything else I would add. No, I appreciate you giving me a chance to talk about the Coimbra Protocol. I hope that more doctors will be interested because I feel like I'm one of the few in the country that's doing it, and I think that there's more interested in Europe. So there really should be, more people interested here. It's such a great thing that's been a great blessing to me and my practice to offer to people, and I continue to do that, and I look forward to, seeing more patients that I can help.
Yeah.
So.
Well, how can people reach you?
Yeah, so our website is jensenfamilywellness.com. And my daughter runs the website. If there's any problems and you can't reach us, you can call us. So it's 928-224-4270.
I'll
And
put
Josie,
everything down below. Yeah.
yeah, and Josie is my front desk, and so it's a very small practice.
Yeah, yeah. Well, hopefully, more people will find you. Just because you mentioned it, why do you think the interest is lower here in the United States, or maybe not as accepted as in other countries like those in Europe?
I think there's definitely and rightfully so. I think there's fear of toxicity, and I think doctors should be careful about vitamin D toxicity because there are cases where, like I was never trained to do the 24-hour urine. I didn't know anything about it. So there are cases where there's autoimmunity with granulomatous disease, and so you can do harm if you don't do it properly.
Yeah.
So I think as long as you get the training, it's really not anything to be afraid of. It's just I'm glad that you're making a training because it's not something that should be very difficult to train on, but it does require some training.
Hmm.
So.
Right. And it's so important to not try and do it yourself. I know I've heard stories of people just starting to take massive amounts of vitamin D, and it's not good for everybody, you know? I mean, I am a huge believer in biological individuality, and some people are going to need more, but we're talking therapeutic uses of vitamin D, using vitamin D to treat diseases, not an everyday need or dose of vitamin D for just the normal general population. So really important to find somebody if you're going to try this protocol to find someone who's knowledgeable on the Coimbra Protocol, knows how to follow up and do the testing, make sure that there's no toxicity, and then give additional guidance for how to avoid toxicity because the calcium can be an issue. And your bone health, you need to make
Yeah.
sure that you stay on top of your bone health. So,
Yeah, I agree. Yeah.
yeah. Well, thanks again for joining us today. It was an absolute pleasure. And I'm sure, if anybody has questions for you, keep an eye on I'll keep an eye on some of the questions that are posted along
Okay.
with this video. And again, I'll put links to your website and your phone number in the video description. So
Hey,
you
hey,
can
thanks a
find you.
lot, Jen.
You're welcome. You're
Okay.
welcome. Thank you and have a great rest of your day.
Okay, you too.